Okay. All right. So first of all, can you hear me?
Yes.
Okay. Thank you. Thank you for your reply. Um,
Yeah, I can hear you.
all right. Perfect. Perfect. Okay. Good. So your 130 test is very similar to the 110 test. The exception is going to be the introduction to these IV therapy flow rate calculations, because that's something you have not done yet. So this is kind of the new thing. Everything else I believe you've seen already, um as far as all the questions that you should have had in 110, with the addition of a what's called a complex problem. And all that complex problem means is that it requires two steps to answer the question, meaning that you'll have to convert the patient's weight in pounds to kilograms and then multiply by the milligram per kilogram order. And it's actually not difficult. It's just that it's considered complex because it's more than just one step. um and then you could argue that you do more than one step when you do some of these other questions, and I would agree with you. So just a couple things as far as review is concerned. You will have an intake question. Typically, Allegheny campus does output questions, meaning that they'll do like a fluid in, and then a replacement volume, and try and calculate how much replacement fluid they need after they void. You guys pretty much just do a big conversion of a bunch of metric, or a bunch of standard American standard units going to the metric system and then calculating milliliters. So it's very similar to what you did last the last test you took in 110. And just a couple of notes. Juice, water, milk are all considered liquids, and really anything that you can make into a liquid. So if you think ice cream melts into milk, ice melts to water. If you have like a popsicle, technically that could melt to, a liquid. But some things that would not necessarily be considered liquid because it's more solid than it is liquid would be things like Jello. I'm not Jello, I'm sorry, pudding. Pudding is more of a powder than it is a liquid, but Jello is the opposite. Jello is more liquid than it is solid. So sometimes you just need to know that, in case they ask you that. But the things that you most likely would be calculating: juice, water, milk. For ice chips, you would do half of what it is listed as in ounces. So if they tell you you have 8 ounces of ice chips, that is actually 4 ounces, and then you would convert that to milliliters. Coffee, soft drinks, tea, all those things are basically water. Jello, basically water. Broth, water. Ice cream is milk. Um, now it says no fruit cocktail, chunky soup. And the reason for that is because a lot of times in like a fruit cocktail, the liquid that's there is minimal. And the same thing could be said for like a chunky soup. The liquid that's there is minimal. Okay. But popsicles and sorbet are just like kind of like ice cream, where you would calculate them. So if they were to melt, you're getting some sort of a liquid component to it. The way that I always keep this in mind is like when my kids were younger, if they had popsicles before bed, we might have the risk and concern that they might wet the bed because they just had like a burst of liquid and sugar right before bed. So it was my wife and I said no popsicles right before bed. So okay. Couple conversions that you need to recall. Remember that 1 teaspoon is the same thing as 5 milliliters. The person who originally put this together had added this 60 drops, but that's I don't know that that's completely accurate. Drops really is dependent on the tubing that you're using. So we don't want to make that equivalent that 1 teaspoon is 60 drops. That's not a fair equivalent. A tablespoon is the equivalent of 3 teaspoons and 15 milliliters. An ounce is 2 tablespoons, which is 6 teaspoons, which is 30 milliliters. Cup is 8 ounces, which is 240 milliliters. Pint is 2 cups, which is 480 milliliters. And then a quart is 2 pints or 4 cups, which is 32 ounces or 960 milliliters. So these are the numbers you want to use when you're making your conversions for like the intake type question. And so the sample that I gave, well, I'll come to the sample. Well, actually, the sample I gave down here is just like, 10 ounces of coffee, a gelatin dessert. And then you're calculating based off of, you want to just convert all these things from the American standard units, pints, quarts, ounces to milliliters. But again, as a reminder, you are responsible for knowing these conversions, just like you're responsible for knowing your cups and ounces and teaspoons and tablespoons to milliliters. You're also responsible for knowing your basic metric conversions. So going from grams to milligrams, milligrams to micrograms, liters to milliliters, kilograms to pounds. Usually you're actually going to be predominantly going from pounds to kilograms. I have yet to see a question that asks you to convert a patient's weight in kilograms to a patient's weight in pounds. It's typically the reverse. Also, we don't typically see doing any kind of conversions with kilograms to grams and vice versa. You could get something like maybe you could get like 0.250 kilograms, and then you convert that to 250 grams, but still that's more you probably see that in a textbook, but you're not necessarily going to see it on your dosage calc testing because your medications aren't administered in kilograms. The only time you're really using kilograms is in regards to the patient's weight. Same thing goes for pounds to ounces. Typically don't have that conversion because that's more of a weight-based conversion. You're going to do more of a liquid-based conversion with the intake question. But they're listed here just in case. But so far, feedback-wise from students over the years that I've been doing these reviews, I've never seen someone say, oh, they missed the question where they had to convert pounds to ounces. Okay. You'll probably have a unit in, I don't know if it's this semester or if you had it last semester, but when you do topical applications, that's where the meter, centimeter, millimeter, especially like surface area, so squared and cubed, might come into play. But again, not typically found on your dosage calc test. And the reason I'm telling you these things that are not there is just to kind of give you a little peace of mind. So you're not like, well, I need to see some examples of, this, that, and the other thing. And then I can tell you like, well, you're probably not gonna have to worry about that because it's not it's not going to be on there. So when we look at the actual blueprint, we're seeing that it's not on there as far as doing skin topical type application based calculations. But you will see it if you haven't seen it already when you do the that particular unit within your nursing program. And again, converting pounds to kilograms. And like I said, most likely you're not going to be dealing with that particular unit. Okay. So what I did and what I would recommend you do in between now and your test next week is to go through the outline here, the blueprint, and look for examples of where you can create these questions of doing like household measurement conversions. So you're converting from metric to household, or typically you're going to go from household to metric, meaning ounces to milliliters, cups to milliliters, teaspoon and tablespoon to milliliters. Those are the types of conversions that that you want to be kind of practicing. And then your metric conversions typically are just converting from kilograms. Well, again, not really a good example, kilograms to grams. I know that's in the oh yeah, that's in the as the example, but a better example is milligrams to grams, micrograms to milligrams. That's the type of conversions you'll be doing. This becomes a little bit interesting because when you do metric unit conversions like this, it's important to note that you don't want to round your answers when you're doing just simple conversions within the same system. Meaning, if I'm going from milligrams to grams or grams to milligrams, I don't want to round my answer at the end. I just want to leave it as it is. Rounding really only comes into play when you're doing calculations based off of weight or calculations based off of administering a medication. Meaning, like, you can't give somebody 2.89734975543 milliliters of a particular substance, but you can give them 2.9. Okay, so you're trying to that's the kind of the way to wrap your head around when do you do your calculations, or when do you do rounding, and I'll kind of intermix that as we're going through this stuff. All right. So I gave a couple of examples. These are usually examples that I will have up. Most students in the 130 section are usually pretty competent and confident with these. But I will ask now if there's any of these that you'd like me to work through, or if you have any questions on any of these. You could just type into chat, like, let me see the milligrams, micrograms one, or just, I know I don't have them numbered, but if there's any of these you want to see, or if you feel pretty good about them, then we'll just move on to the more complex things. All right. So I'm going to go ahead and move on to the more complex things. If at any point in time you're like, whoa, wait, I need to see, how to convert pounds to kilograms. What's this whole rounding thing that you are talking about? Just tell me to go back and we'll go back. Okay. I also am hopeful that you are pretty solid on the fluid intake question. Really, the only thing that's going to change here is, the amount of ounces, the amount of pints, quarts, cups that you'll see sometimes. And I've had students, like, this will be like 2 gelatin dessert, 2.5 ounces. The way I interpreted that was 2.5 ounce desserts, so a total of 5 ounces. But I know that, so hopefully you won't get that as a question where, like, there's 2 or 1. Hopefully that's a fair question to ask, just to say, like, are you saying there's, or if you ask your instructor, are you saying there's 2 that equal 3 ounces, or 2 3-ounce desserts? So my guess is that I just made that up, and that was probably the wrong thing to do. Okay. Does anyone need to see calculating the total volume here, or are you guys okay? All right. So let's do the flow rate type questions. So I have a few of these that are just written maybe a little bit differently than you'll see, but I think that they'll still be helpful. And so I always like to start off with the non-drop factor questions, just because so I like to start with these down here, and then we can work towards the drop factor type questions. So this is where I'll start recording some things here for you. So open this up. Oops. Okay. So let's look at I'm gonna start back just a little bit. I'm gonna bounce around a little bit, but this will all make sense. And then you'll be able to see my work. Obviously, I'm recording this, I'll upload this to YouTube. And then I also will have this up and available. Like, you can see my markings in the shared folder, where you'll be able to see my markings there as well. So let's start with this one here, where it's talking about 240 milliliters in 40 minutes for an ensure tube feeding. And the question is, the question is, we want to calculate a flow rate. Now, flow rate is either going to be talking and referencing milliliters or cc's per hour, typically milliliters per hour, or it might be representing and asking for drop rate or drops per minute. If you're wondering if it's a drop type question, typically there's going to be some reference to drops in the context of the question. Meaning, if I go up here and you see where it says drop factor is 10, or it uses microtubing or something along those lines, that's how you know you're most likely going to be calculating a drop rate, even when it just asks for the flow rate. Okay. And then I'll get to that in just a moment. All right. So we're going to start with this question here. Patients must receive a tube feeding of Ensure, 240 milliliters in 40 minutes, and we want to calculate that flow rate in milliliters per hour. Some of that is just because when you are doing your infusions, whether we're talking about tube feeding or via IV into the patient's bloodstream, like you want to make sure you're programming it in because into the pump system, and that it's set correctly so you're not overwhelming them, and then also that you're not underwhelming them with the flow that needs to be coming in. So you might be thinking, 240 milliliters in 40 minutes seems like a minimal amount, which is true because 240 milliliters is really just a cup of, or half cup of Ensure in 40 minutes. So if you've ever drank a half cup of anything, you can down that in like 2 seconds. But there's a reason for this. You're trying to titrate it in, and also it's just a made up number. So, but where people sometimes get hung up on these types of questions is when they see things like, so they see the milliliters, which they're good with, but then they see minutes. Okay. So there's a couple ways to get this, but basically you just have to convert minutes to hours and then get over the fact that it's going to make your number higher because you would need to consume a greater quantity within an hour to make that up in 40 minutes. And so I'll show you what I mean by that. So I'm going to start off by just writing out what I know. 240 milliliters and then 40 minutes. Now, the kind of the dimensional analysis approach to this, and just to kind of show you, just in case you ever get stuck, is all you're going to do is you're going to convert minutes to hours. Okay. You're trying to get rid of minutes, convert it to hours, and then that 1 hour is 60 minutes. And so all you're going to do is 240 times 60 divided by 40, and that'll give you your feeding tube answer. So let me pull out my calculator. 240 times 60 divided by 40. And you're going to get an answer of 360 milliliters per hour. Now you might be saying like, well, wait a second, 360 milliliters, but they only are supposed to get 240 milliliters in 40 minutes. That is correct. After 40 minutes, the 240 milliliters will be gone, or you're turning off the pump. There's you're shutting it down, but you still have to set the infusion or set the flow rate for what it needs to, or what it would be if it went a full hour. Okay. So that's how that works. Okay. So that's the rate. So, but I don't think many people are getting hung up on that, but just letting you know. Okay. So when we look at this, the alternative way is you might be saying like, oh, okay, well, I know that 40 over 6 is the same thing as 0.6 or 0.7 hours. You can do that, but I would just be careful with using the decimals. And I personally would tell you to set it up like this, 240. If you wanted to say like, 240 divided by 2/3, because 40 minutes is 2/3 of an hour, that's fine. But some of you, like, as soon as I said that, were like, what? No. I think this is the more direct way. Alternatively, like, let's look at this one where we have 15 minutes. So that 15 minutes is a quarter of an hour, right? So so you could do it that way, where you have a solid number, but again, you're working with decimals. And if you're like me, you don't really like to multiply and divide by decimals if you don't have to. But if you are sitting there going like, well, I know it's, 0.25 of an hour or 1/4 of an hour, you'll still get the same answer as if I had set it up this way. But I'm telling you, if I'm doing it, the dimensional analysis way, this is my preferred method, just because then you can see it. Then you can mark out what you're looking for. But either way, you're going to get the same answer when you do this. Okay. So I think it's 2000 milliliters. Yeah. 2000 milliliters per hour. So those are the first kind of flow rate type questions you might see. The alternative way that might get asked is, you have a set amount, it's running for a certain period of time. How much or how long will it last for? And so I'll give you an example of that. So let's go ahead and do an example of that. I'll leave this one for you to work on and try. And then we can come back to it if you feel like you don't have that answered. But I'm going to come back up here and we're going to talk about this one here. So in this question, it's asking, we have 250 milliliters of an IV running at 100 milliliters per hour. And the question is, how long will it run for? Basically, when will it be done? So what I'm asking for is how much time will have gone by in that hour or after the 100 milliliters per hour for 250 ml. So there's a little bit of manipulation. And this is where I think dimensional analysis really kind of proves its weight in importance and functionality. And what I mean by that is I'm looking to calculate how many hours and minutes, and I'll show you how to do that in just a second as well, based off of this information here. And so what I'm going to do is I'm actually going to take my 250 milliliters, it's my total volume, and I'm going to actually divide it by my rate, the 100 milliliters per hour. Now, when I do that, what that's actually doing, that's the same thing as saying, this is kind of like the ordered over half kind of setup, but you need to know which ones go where. But this is the same thing as saying this right here. Okay, so if I see 250 milliliters divided by 100 milliliters per hour, it's the same thing as saying 250 milliliters divided by 100 milliliters times 1 hour. Okay. So when I do the calculation, 250 divided by 100, and I'm going to get 2.5 hours. And then you know that a half an hour is 30 minutes. So you would say 2 hours, 30 minutes to answer this question correctly. So if you got 2.25, you'd say 2 hours, 15 minutes. If you got 2.75, you'd say 2 hours, 45 minutes. If you got some sort of weird, funky, like let's say you got an answer that was like 2.6667, like just kept going on. What you would want to do is if you take that 0.6667 and multiply it by 60, you'll actually get a number that gives you a whole, gives you a whole number. So if I take that 2.6667, if I were to translate that, that would be the same thing as, so all I multiplied by was this. Oops. So I multiplied by this by 60 minutes, because right now it's in hours. Okay. This would be 2 hours, 40 minutes. Okay. You actually get 40.002. It's 40 minutes. We can safely assume we don't need to worry about the seconds. If you really wanted to, you can multiply the 0.02 by seconds, and you can even get it down to the second. Okay. But my guess is that it'll be a solid number, that it will either end as a whole number or whole and a half. And it should be pretty straightforward to do, to answer it. And I don't even know if you'll see any questions like this, but technically this is a flow rate type question, which is why I always include it. Okay. There was one other thing I was going to mention about, so the other variation of this, because I don't know that I have an example of this. And again, I don't even know that you will be responsible for it, but I think it's good that you know about it, is sometimes it'll tell you that, you have 250 milliliters of this dextrose 5% water IV running at 100 milliliters per hour. It's and then like it'll say it started at 8:30 a.m. on a Tuesday. When will it end? And then you would still do the same math. You'd get to 2 hours and 30 minutes, and then you'd say, okay, so it started Tuesday at 8:30 a.m., 2 hours and 30 minutes. That's 8, 9, 10, and then another half an hour. So it'll end at 11 a.m. on Tuesday morning. Some of the things have like longer periods that they're infusing for, like, 6 or 8 hours. It might start at night and then need to be transferred over. And so anytime they tell you like you need to know like your 24-hour, your military time, then that's kind of where those questions come in. But I would say very few people miss or mistake those questions. So I'm not too worried about that for you guys. And I don't even know that that's a question you'll even need to worry about. But if you do happen to come across something, or you see a sample question, or you see something on ATI and you have a question about it, please feel free to reach out to me. I will help you navigate that. All right. So let's do some of these drop factor questions. So with drop factor questions, basically we're just adding additional piece of information to calculate a flow rate that's going to be in drops per minute. Usually what we're doing is we're adding via IV like piggyback, but we're adding basically a medication to an already ongoing infusion, meaning I might have, somebody on a saline solution, obviously for hydration purposes, and then we're going to add in some things. It might be heparin, it might be insulin, it might be, like it says here, gentamicin, which is an antibiotic. Like it could be any number of things that we want to titrate in small amounts slowly via drops. Some medications require more drops per minute, and some medications require less drops per minute, but this is just how you would make these calculations. So the first thing I always like to start off with is, what is flow rate, or what is drop rate? So there's a simple formula that says you're going to take your flow rate times your drop factor, and that will equal your drop rate. Flow rate typically is milliliters per hour, but it could be milliliters per minute. Your drop factor is typically given to you, and it's drops per milliliter. And your drop rate is always going to be in drops per minute. Now, you might be wondering, why are they using GTT for drops as opposed to DR for drops? DR was already taken. It's an apothecary unit. It's DROMS. So if you have a bottle of perfume at your house, you can look at the bottle of perfume and you can see that it is listed in milliliters as well as in DROMS. So like you can have a drum of, whatever your favorite perfume is. They don't use that terminology anymore in medicine, but it is, you might see it in older textbooks, you might see it in older example questions, but typically you're not dealing with DROMS, and you won't see it on your dosage calc test. Now, the reason I'm giving you two types of flow rates is because ultimately you want your final answer in drops per minute. So if it gives you, a volume per minute to start off with, then just, you want to leave that as is. Okay. So I just had a question. Yes, I will post this on YouTube. It probably won't get posted until later today or even tomorrow, but yes, I will post all my reviews on YouTube. You are going to waste a step if you convert your flow rate into milliliters per hour if it's already in milliliters per minute. So leave it at milliliters per minute if it's in milliliters per minute. And so this first example tells you, it's already in minutes. And then there's some extra information and we'll kind of navigate that. So let's go ahead and let's figure this out. So it says to administer gentamicin 75 milligrams in 150 milliliters dextrose 5% water over 35 minutes every 6 hours. Drop factor is 5. What is the flow rate? Now, there's a lot of extra information in here. So remember when I told you when we're calculating drop rate, I need two pieces of information, flow rate and drop factor. Flow rate is volume over time, and drop rate and drop factor is given to you, and it tells you it's 5. Okay, and 5 drops per milliliter. So where it tells you 75 milligrams, that's important for the context of making sure you're administering the correct strength of the medication. But as far as calculating the flow rate, it does not factor into your calculation. So one of the things I try and get students to recognize is that there is sometimes extra information listed in here from a dosage calc perspective that you can just ignore. So I don't need to worry about 75 milligrams. Sometimes students try to figure it out or put it in somewhere, but the milligrams has nothing to do with flow rate. The milligrams just tells you what you're bringing in, and then it is important from a medication standpoint, but it's not telling you what what to set the flow rate to. And the example I always use, and if you've watched any of my reviews on this topic, you may have heard me say it's kind of like saying, like, we're going to take a trip to Kennywood, and I'm going to take a minivan and you're going to take your your Tesla. It doesn't really matter the vehicle that we're taking. We both have to basically go the same rate of speed to get to the place that we're going to. So if we're talking about, who would win, that's a separate question. But if it's the time traveled, let's say it takes us each 40 minutes to get there, we would just take the travel time over the time, or the mileage over the time, and that'll give us our rate. It doesn't matter that I was in a minivan and you were in a Tesla. It's just how it works. So it's just the rate. Okay, so I think that makes sense for most, even before I explain that. So let's solve this question. I'm going to take 150 milliliters and I'm going to put it over a time. Now there's 2 times here. It says over 35 minutes every 6 hours. The over 35 minutes is what's telling you your flow rate. Okay, because you want to administer that 150 milliliters of dextrose 5% water containing 75 milligrams gentamicin in 35 minutes. That's the goal. The every 6 hours is that you're going to repeat it, right? So this is kind of like taking an oral medication where you have the where it would be like 4 times a day, right? Because there's 4 6-hour intervals in a day. Okay, so it's the same thing. So we're not necessarily calculating for the whole day right now. We're just calculating for the 35-minute time period. So I have my 150 milliliters and I have 35 minutes. Then I'm going to multiply by my drop factor, which is 5. And again, the reason I always set these up into dimensional analysis is because, remember, we already know, even though it doesn't tell us, like, because it just says what is the flow rate, it doesn't tell us specifically what to look for. But I already told you that when we're calculating a drop rate, and we know we're doing a drop rate because it gives us a drop factor, we're going to calculate for drops per minute. And so before I do any math, I am already in the correct units, drops per minute. So I'm going to take 150 times 5 divided by 35, and that'll give me my answer. So let's see what that comes out to be. 150 times 5 divided by 35. And I'm going to get a decimal answer, and it's going to say 21.428. There's more numbers after that, but we'll just leave it at that. Now, you have been trained very, very well to round that to the nearest tenth. And then, so you might instinctively want to write 21.4. However, we can't do that. We cannot give someone a partial drop. You either give them a drop or you don't give them a drop. So it's always going to be with drops. Drops are always going to go to the whole nearest whole number. So your answer for this would actually be 21 drops per minute. Okay. Now, there is some debate, and I've heard people say, like, well, wouldn't you just round it down to 20 because that's all you can set it to, or round it up to 25 because, and that's the nuance that occurs within the actual clinical application of drop rate. But when it comes to the dosage calc kind of approach to this, we're just going to do round to the nearest whole number. Okay. And most of the time, your answers are going to be like 20, 25, 30, 35. They're going to be solid numbers, and you won't have to worry about it. But when I make up these questions kind of off the, just kind of plugging in numbers, I'm purposely trying to do that so it makes it look like this doesn't look right. What's going on here? And then to kind of challenge you to pay attention to your rounding rules as well as your when you and what those rounding rules are. And when you deal with drop rates, you want to make sure you round to the nearest whole number. I've also had the question of, what do I do with flow rates? Do I round that to the nearest whole number? Again, that's a debated thing. Ultimately, I have not heard an argument of somebody saying not to do it this way, but typically I would tell you, just because it can be programmed in certain pumps and situations, where like if you get an answer of like 125.7 milliliters per hour, then that's your answer. Just leave it rounded to the nearest tenth, because you can give a tenth of a milliliter. Does it make sense? I don't know that it makes sense. And I'm not here to tell you what makes sense or not. From a clinical standpoint, I'm just trying to help you out with the math part. And usually when whomever's writing up your math test, they account for those things, and so you don't have to worry about it as much. But just giving you a heads up so you know, just in case. Okay. So this second version is the same type of question. You have, instead of 150, it's 75. Instead of 35, it's 25. Instead of 6 hours, 8 hours. Instead of 75 milligrams, 45 milligrams. And then the drop factor is also different, but you're still going to plug it in and do exactly the same as you did the first time around, or as I shown it. So I'll leave that for you to practice and make sure you have down.
Dr. Red,
Yes.
I got a question for you. I'm actually unfortunately retaking 130, so I already took this test, and this is a dumb question. But you know how it says like 75 milliliters over 25 minutes? Would it ever say like 75 milliliters over 2 hours? You know what I
Yeah.
mean?
Yes. And
Okay.
I
And I
and I
can't remember. I don't think that was on the test last semester. I can't remember, but I just was wondering.
sometimes I have a question like that, but I don't hear. But let's make another scenario. Let's make another question that's similar, and then that way you can see what that would look like, because you are correct. Yes, there are times where you can get that. So let's say, it's let's say it's 30 milligrams. Let's say it's 250 milliliters. And then I'm just going to say in 2 hours with a drop factor of 10, what is the flow rate? I'll make this drop factor, let's make it 15. So I'm creating a scenario where I don't know how this is going to end up, but yeah, you can have it set up where it is, this like with 2 hours. Sometimes it could be longer. Like I have one that's like 1440 cc's of like basically blood cell platelets over 12 hours. And then it's like real big numbers, but I don't know that that's a good example. So again, we can ignore the 30 milligrams, but we want our volume and we want our time. Now there's 2 ways to do this. You can convert hours to minutes right off the bat. That's usually what I like to do. Or you can set it into your dimensional analysis. But to keep it simple, we know that 2 hours is the same thing as 120 minutes. So I'm going to put that down here instead of 2 hours. So the only thing that changes is the quantity of minutes. Then I'm going to multiply by 15. And then you'll get 250 times 15. Divided by 120. And then you'll get 31.25. And like I said, we can't give them partial drops. So that would just be 31 drops per minute.
Okay, cool. Yeah, I made that way more complicated. I don't know why I was like, I don't know. I just wasn't. I haven't had much sleep, I guess. But yeah, I made that harder than it is.
No, and I appreciate you saying because it's helpful to kind of look at it. And you're right. Like if you're like just kind of like you're not firing like on all brain synapses because of being exhausted, that's where you can make sometimes just simple mistakes or just not know what the heck to do. But remember, like even if it gave you like 2.5 hours or gave you like 2 hours and 45 minutes and it gave you some weird numbers, as you're just trying to get that number to hours, I mean to minutes, before you kind of do anything else with it, or at least make sure you do that at the end. Otherwise, your number will be way too big. It'll be something like 300 drops per hour, which makes sense. And then it's, obviously less than that, like 5 drops per minute if we leave it at that rate. Do you remember what you missed on your dosage calc test for 130?
I got a 24 out of 25 the first time.
Oh,
This is like a refresher because I haven't used my brain in like 2 months, like as far as school goes. So,
sure.
um, and I was just trying to think back. Like I couldn't remember if there was an hours one. I remember there was obviously a drop factor one, and I remember it was kind of confusing, but I can't remember what it was. Like I said, that was so long ago now.
Okay. Yeah, don't worry about it. I mean, you passed, so like the dosage calc part. So yeah, it was probably like it could have even just been a rounding mistake or like a units mistake and something simple. So that's okay. I just thought I'd ask.
Oh, no problem. Thank you.
You're welcome. All right, so the best thing I always tell you guys, this is just to practice your flow rate questions. There are plenty of samples. If you go into my OneDrive folder and you go to the Allegheny campus, and if you look at the second, third, fourth semester questions, there are lots of flow rate type questions in there, and you can practice those. There's keys to a lot of those already posted. And then if there's something that you try and you not 100% certain of the answer, just email me. Email me the question and then what you got as an answer, and I will tell you if it's right or wrong. All right. All right. Now, the other question, like I said, that's a little bit like new and different is going to be something like this, what's considered like a two-step type question. Okay. And then usually these questions get a little bit longer. When you get into third semester, you're going to take pediatrics, and then pediatrics has its own drug calc test that you'll be responsible taking, but it's within the semester and it's part of that class. And it's more about weight-based calculations and calculations within particular ranges. And you'll be more than prepared when you take that. But and then if you have any questions, of course, you can reach out to me. But in this example, what we're trying to do is calculate, based off of the patient's weight, the how much to administer for a particular patient. So it says that the doctor writes an order for ibuprofen, 3 milligrams per kilogram by mouth every 6 hours for pain for child. The child weighs 73 pounds. Okay. The pharmacy dispenses you with 50 milligrams per 2 milliliter ibuprofen. How many milliliters will you administer per dose? So you've already done questions like this. This is considered like not parenteral, but a oral based medication with the intention of you giving or it being administered in a liquid form, or you telling the patient's caregiver like what to give them 2 spoonfuls, give them or teaspoons or whatever it happens to be. But in this instance they want to know how many milliliters. So how do we solve this problem? So in order to solve this problem, the first thing we have to do is we have to take the patient's weight and we have to convert it to kilograms. Okay. So I'm just going to say to kilograms. So we have to convert the patient's weights pounds to kilograms. So that's step one. Okay. Now you can do this as like its own step, which is usually how I introduce it, or you can do a full dimensional analysis. But I know that a lot of students, especially those of you who are hesitant to doing dimensional analysis, are not too keen on that. But I always do it as like kind of like a pre-step, kind of like when I converted the 2 hours to 120 minutes. So I usually I'll take out my calculator. I won't even necessarily write it down, but sometimes it's helpful to write it down. So what I'm going to do is I'm going to take the 73 divided by 2.2, and I'm going to get 33.18. Okay. So I'll write out what I'm doing. So I take 73 pounds divided by 2.2 pounds per kilogram. And I'm going to get 33.18, and it just keeps repeating 18. And I'm going to round that to the nearest tenth, so 33.2 kilograms. Now I've had students ask me, well, what if rounding that changes my answer? It shouldn't change your answer, and I'll show you what I mean by that in just a moment. It should not change your answer when you round to the nearest tenth, especially when the patient's weight is over 10, 20 pounds. The kilograms and the whole number, or it's going to be a greater number than is your end result, meaning that your final answer is either going to be 100 or 100.01, and you're still going to have the same answer of 100. Okay. But I'll show you what I mean by that. But let's just start off with this. So I have the patient's weight in converted to kilograms. Now I'm going to multiply by my order, which is 3 milligrams per kilogram. So 33.2 times 3 gives me 99.6 milligrams. And then you know how to do the rest of this because you've done this before. So the order is 99.6 milligrams. And then you're going to give them 2 milliliters per 50 milligrams. So if you like to do the ordered over available, this is a perfect time to do that. So I'm going to throw that in here. I'm going to divide by 50, multiply by 2, and then I'm going to get 3.984 as my answer. So you're going to tell mom to give. So it says it's 3.984. You're actually going to give 4 milliliters, because you don't need, like, if that is 3.98, it's 4. So you would round that to 4. I know you were like, well, wouldn't I round that to the nearest 10th? Well, you can, but 8 rounds 9 up to the next number, which is going to give you 4. And trying to think about realistically, how are you, like, who's administering this? It can be a parent or a caregiver, and you're probably going to tell them, give him, a teaspoon and a little bit more, or 4 mil based off of a syringe. My guess is that they would tell you to give them a teaspoon, which is 5 milliliters, and then just be like, it's close enough. That's kind of probably what my assumption would be. Plus, that the parent is either going to give them a little bit more or a little bit less anyways, depending on their particular preferences with how they're administering medications. And this kid's 73 pounds, probably means they're like 9-10 years old. I think a teaspoon of ibuprofen is probably going to be minimal, which is, again, what you're trying to do when you're titrating a dose anyways, for based off a patient's weight. Now, let's say I didn't do the rounding, because here you're saying, like, wait, did you round twice? Technically, yes. I rounded pounds to kilograms to the nearest 10th, and then I rounded my final answer to the whole number. So let's say I didn't do that initial rounding. So I take 73 divided by 2.2, and I get this really big number of 33.181818181818. I multiply that number by 3, and then I get 99.545454. I divide by 50, multiply by 2, and I still get the same answer I got before, but instead of 3.984, I get 3.981. Okay. So again, still going to put my final answer as 4 milliliters. So when we say something is, a 2-step or a more complicated type of question, really what we're saying is you're going to calculate patient's weight in pounds, convert it to kilograms, and then you're going to use that kilogram weight information to solve the rest of the problem. And usually a good clue that you're doing that is they'll tell you 3 milligrams per kilogram. Sometimes they'll give you the patient's weight already in kilograms, and that makes your job a lot easier. And it's still considered 2-step because you're accounting for the patient's weight to get your ordered medication in milligrams. All right. Okay. The rest of these things are things that you saw already last semester. For the insulin, it's just they're going to give you like a number. It's going to say that their blood sugar was at 365. How much would you administer? And then you just look at the different ranges for the blood sugar, and you can see that 365 fits in here. Okay, so if it was 265, if it was 165, you can just see the different areas that they would that you would put or administer insulin or not. If it tells you no coverage, then you know that you don't need to give them insulin. And then I think at this point, you're pretty good at these as well if you got through, because you saw this in first semester. Remember, when you're dealing with the reconstitution questions, what you're looking for is a reconstitution is basically the same thing as any other oral-based medication, or even parenteral medication or subcutaneous or IV type medication where it's a liquid component. And then the clue is your available label will just tell you 1 gram, even though it tells you it's intramuscular. So it's injectable, and you can only inject liquids, and liquids are measured in milliliters. And that's your clue to look at the label to look for the information indicating, okay, this is the concentration A lot of times you don't have to do any other kind of calculation other than find that information. So like on this one, the strength that you're looking for or you're available is this 330 milligrams per milliliter. In the OneDrive shared folder, I also have some examples of other reconstitution type labels, but what tells you you're dealing with a reconstitution is it'll just say 1 gram. Okay, then that's your clue to look at the label, look at the instructions, and then oftentimes the instructions tell you specifically what milligram per milliliter it is, and then you just do your either dimensional analysis or ordered over available to calculate how many milliliters to administer. And then sometimes with these questions, you'll have like a syringe to mark. You just mark the syringe in the correct location. All right. So that's my time for this morning for the 130 section. I'll be doing my Allegheny reviews. So like I think I do 130 again at noon, but it's for the Allegheny students. You're always welcome to drop in on those. It's the same link. I'll have a different kind of review sheet that I'll be going through. But I'm just giving you a heads up that you're welcome to join in on that. Otherwise, I'll be doing more Boyce specific reviews again on Thursday, and again at the same time at 10:45. And if you're unable to make it, please feel free to email me with any questions you might have, and I will answer them. And if it's a more complicated question, I'll like I'll create a video for it and I'll upload it to YouTube and then send that to you. So, and if I don't see you, good luck on your test. And thanks for coming.
Thank you.
Thank you so much.
You're welcome.